Breaking news. 2 pupils have died of meningitis at Mwense Secondary School as government confirms an outbreak of the disease. Hello and welcome to Generation TV News right here. Ima guys, government yachitako confirm ati kuliko outbreak ya meningitis mdala. Yes, na pupils babidi paja pa Mwense Secondary School vafa. Yes, so I'm going to play for you the video by the Minister of Health, right? Yeah, in the meantime, short commercial break and then I'll be back. A golden opportunity for entrepreneurs. 3 big shops for sale in Kitwe at Kapoto Market, close to Zambiv. Area size 50 by 35, containing 3 shops, and one of the shops has got a storeroom suitable for retail and wholesale business. Running water and electricity available for convenience. The shops are 100% safe, secured, and are painted inside with a ceiling board. Price 150,000 kwacha. Yes, you heard it right. 150,000 kwacha for 3 big shops. For more information and viewing, give us a call now on 0962 80 1156. Grab this chance to own 3 big shops in a prime location. Alrighty, thank you so much for staying tuned, ladies and gentlemen. And now the news in detail. Health Minister Elijah Muchima has announced an outbreak of meningitis at Mwense Secondary School in Mwense District, Luapula Province, with 2 deaths recorded so far. Addressing the media in Lusaka today, 10th July 2025, Dr. Muchima explained that last week the ministry received information about the sudden deaths of 2 male learners, both aged 19, from Mwense Secondary School after complaining of fevers, headaches, abdominal pains, and dizziness. Dr. Muchima says these deaths occurred after a few hours of admission to Mwense Urban Health Centers. He says government has since conducted an initial risk assessment which classified the outbreaks as high risk, and common symptoms identified including fever, neck stiffness, altered mental status, headache, nausea, and vomiting. Dr. Muchima says in response, government has established isolation centers at Mwense District Hospital and Mansa General Hospital. Dr. Muchima has also disclosed that in the last 24 hours, the school has recorded 2 suspected cases, 0 deaths, 6 discharges, and 17 patients currently admitted, bringing the cumulative total to 83 suspected cases, 5 confirmed, 6 discharges, and 2 deaths. More details in this video.
Last week, we received information about the sudden death of 2 male learners, both aged 19, from Mwense Secondary School on 8th June and 3rd July 2025, after a few days of complaining of fever, headaches, abdominal pains, and dizziness. These deaths occurred after a few hours of admission to the Mwense Urban Health Centers and Mwense District Hospital. Over the past 1 month, the hospital has recorded an increase in the number of learners visiting the health center due to flu-like symptoms: fever, cough, headaches, vomiting, and diarrhea. Most of these illnesses were treated as outpatients. However, last week, the number of students with the symptoms and severity of symptoms increased, with 10 learners, that is 2 female and 8 male, admitted to Mwense Hospital, and 6, that is 2 female and 4 male, in Mansa General Hospital after being referred from Mwense District Hospital. The symptoms of these admitted patients included fever, neck stiffness, cough, sore throat, abdominal pain, and diarrhea. Fellow citizens, Mwense Secondary School has a total of 1,112 learners, with 576 being boys and 536 being girls. 16 are boarders, whereas 502 are day scholars. At the time of our team visit, only 205 learners were in the body, and the rest of the boarders left following the second death and taking place. The initial risk assessment of this meningitis outbreak has been completed and is classified as high Following are the immediate actions undertaken so far. 1. Establish an resident management system at the district level. 2. Hold a meeting to inform key stakeholders for their active participation. 3. Started engaging the affected population and caregivers on preventive measures, signs and symptoms of early reporting. 4. Train health care providers at the district hospital on clinical prevention of meningitis for quick identification of cases. 5. Establish an isolation center at the Mwense District Hospital at the school, including identifying personal hand hygiene, cough, ethics, wearing masks, and seek early care when one develops flu-like symptoms, fever or headache, and increase active surveillance in the school and surround. Death 0, discharge 6, currently admitted 17 patients, 9 in Mwense District Hospital and 8 in Mwense Secondary School. This brings the cumulative total to 83 suspected cases, 5 confirmed. All pneumonia cases, 16 discharges and 2 deaths. I would like to appeal to the well-wishers